sorry, News. Dr.
Hi.
Zheng is offline, I think. He's having a 10 minutes break, 5 minutes break, but
no problem. I'm back.
yeah. Oh, yeah. Okay, great. So, News
Yes.
has a question for you. Yeah, please. Yeah, you can go ahead.
Yeah, very nice presentation, Dr. Zheng. I really enjoyed it. So great presentation skills. I have a couple of questions about the design of your study, and I was about to type them in the chat, but I can also post them like this. So in the end, what is important, so more and more what we do with side branches is professional. I think you do the same, because if you don't have to stent the side branch, then you rather would not like to do it, because it compromises often the result of your main branch result. Maybe not instantaneously, but at least on the long run. So your chances for stent thrombosis or stent restenosis are much higher with a side branch construction as compared to a single vessel construction. So do you expect that this technique will lead to more side branch stenting or less side branch stenting as compared to angio?
Thank you. You very important questions, and it's a good point. And as we know, I think there is another question about the sample size calculation. I think the same one.
Yeah.
And because we just calculate the sample size is just according to the previous study. As I mentioned, the DK6, the FFR. I think it's totally just from the experience from this study and all the sample size of 320. I think we just at least included this sample size to at least 320 patients. And another question from you is just what the expectation for this clinical study. And for me, I think the application of the CA-FFR, the angio-based FFR, is very similar to the FFR. We just could avoid unnecessary intervention. So even we just find some very tight lesion and very ugly ostium of the side branch, but if we just calculate to measure the functional significance is not significant. So we just leave it alone. We just before. I think we should avoid some unnecessary intervention, but we have to do very carefully follow up and to see what's going on, because there's only not. I think the FFR value, what the CFFR value, just to evaluate the functional significance just at that time, but it's not for the follow-up. We have to see what's going on, because the morphology has changed, especially for the morphology of the bifurcation has changed. So there might be something we don't know. We have to see what will happen.
So personally, what I do most of the times is, if I have a patient with a side branch that is compromised, I don't even look at the severity of the stenosis. The only things I'm looking for is the TIMI flow in that side branch, whether the patient has complaints, and whether the EKG is changed. And those are, for me, the only three reasons to do a side branch stenting. So I'm very conservative in that respect, because, well, for prognosis, side branches normally don't matter. And as said, only if you're really forced to, then you should continue with the side branch stenting. All other cases, I would try to refrain from it. So what is your personal expectation if you're gonna use this technique for all your side branch situations? Will you end up with more or less stents in your side branches?
I think it's less dense, but maybe some intervention. I mean, maybe some casing bloom, even, you know, in China, there's some other clinical trials to do the DCB, the drug-coated bloom, for some very important cell branch, and maybe increase the use of application of this kind of technology. But I think it should be avoid the two standard strategy, because it might increase the risk of very late or even early complication, for example, thrombosis or some.
Exactly. Okay, well, thanks a lot and very clear answers. Great presentation. Unfortunately, I have to leave because I have some other duties now, but looking forward to collaborate this in the future, and good luck with the rest of your webinar.
Thank you. Thank you.
Okay, bye-bye.
Thank you. Thank you.
Thank you.
Thank you, Niels. Bye-bye. Thanks.
So I think that Dr. Chen, you mentioned about the bifurcations used, especially this new technique in guiding the protocol in treating the bifurcation stenosis. So I think that maybe it's time that the others can join the discussion about that.
Yeah, okay. Now, if you have some questions or doubts, please drop your questions into the studio. Dr. Zheng would help answer the questions about the bifurcation lesions.
And another issue we just discussed before the presentation with John, with Bob, and we have to just improve our algorithm of the bifurcation assessment, and to just provide much more accurate calculation assessment for this kind of very complex scenario, because, you know, the hemodynamic status of the bifurcation lesion is quite different for the just a straight one finger lesion. It's very complex, so we have to improve our algorithm. But I just looking forward to improve. I think it's will be improved in the near future.
Yeah, that actually thanks your suggestion and your expectation for that. Okay, besides the question, there is a questionnaire for our webinar. Please help Ken to finish the questionnaire also to help us improve the performance in the webinar. Yeah. Okay, any other problem about the presentation? Just drop the question into the studio, so then we can see the question directly. Or if you want to communicate with Dr. Zheng directly, you can turn on your microphone, no problem. Yeah, maybe some distributors, they will be back in 1 or 2 minutes. Just a moment. During the waiting period, our market specialist, Nick, would show us a short video about the CFFR system, the operation procedures, so that because this time we found some experts or distributors, they are new, they are first time to join our webinar. So it's better for us to keep a short video to introduce the operation procedures for you. Just a moment, Nick is preparing.
Co. Ltd. is a high-tech enterprise specializing in the development of accurate diagnosis and treatment of cardiovascular diseases. To better meet clinical demand, the company has independently developed a non-invasive and a mini-invasive FFR-oriented system. Coronary angiography FFR analysis system, consisting of post-processing workstations, pressure analyzers, and invasive pressure sensors, can assess the coronary artery with low cost and high efficiency. Our innovation in IP covers more than 20 patents related to cardiovascular field. With clinical and engineering experts from across the world, our team of advisors combine new technology that has been clinically recognized and approved by a number of medical facilities in China and abroad. By combining coronary angiography, CAG, 3D reconstruction, real-time aortic pressure, and hemodynamic algorithm, and without any vasodilator treatment or guide wires, we can calculate the instant FFR in a highly accurate approach.
Okay, moment. We will share you another operation procedures. Okay, just now, sorry for the waiting. About the CFR system and the presentation of Dr. Zheng. If you have any question or doubts, just drop the question in the studio. Yeah. Actually, if there is no other questions or doubts, how to say, if you need some information about our CFFR system or some cooperation or with us or Dr. Zheng, you can send an email or to us, or you can search our YouTube, LinkedIn, and our website to get more informations. Yeah. Okay, Dr. Zheng, it seems now there is no other question. I think we can finish the presentation here. How do you think? If you have some others you want to share with us, maybe you can share some other informations.
No more comments. Thank you for your invitation. And yeah, it's really my pleasure to just to share our experience and to discuss with other experts from all over the world. Thank you.
Okay, thanks for Professor Zhen's sharing. Okay, so today, thanks again for your participation, and we sincerely wish you and your families peace and healthy during the COVID epidemic. Of course, please tell us if you need some assistance. Now we can call it an end of today's meeting. Thanks for your time again, and I'll say, just like I mentioned, if you need more information about our system, just contact with us with emails, or you can search the website of us. Yeah. So if no more comments or questions, we can finish the meeting. Thanks very much for your coming. Thanks very much.
Bye.
Okay, bye-bye. Thanks, Dr. Zhen.
Okay, bye-bye. Thank you, Dr. Zhen. Thank you for this wonderful presentation.
Bye. Thank you.
Thank you. Thank you, everybody. Thanks, all. Bye-bye.
Yeah. For the presentation, later we will communicate with Dr. Zhen and confirm whether we can share to you. Thanks.
Yes, and we hope that we can have some cooperation in this workout. Thank you. Thank you.